Hello and welcome to your week in review. This recording will provide answers to your homework assignments from the previous week, from week 1, and will also provide some information that I don't cover in the normal recorded lectures over the textbook chapters, but information that I think is important to you. So the first thing I want to point out is that you do have a list of medications that may be on your exam that you can find under the third module. And that third module is titled Exam Drug Lists. So if we're going along and you're like, I think she said this one's important, I'm not quite sure, you can go to that list to see the medications that I said you need to know for testing purposes. So for exam 1, it'll list all of the medications, right? And you'll notice that some of them are bold. The medications that are bold are your prototype medications. So these are medications that are commonly prescribed from the classification. So for example, epinephrine is your prototype medication. For an adrenergic agonist, norepinephrine, dopamine, dobutamine, or other medications that I want you to know, they're just not that prototype. So when you see a bolded drug name, you should recognize it as the prototype drug, which is important. And also when it comes time for our comprehensive final, the final will include the prototype drugs. So when you zone in on what should I focus for the final, it's going to be the prototype drugs. And that's the extent of any sort of guidance regarding the final exam, is that it will cover those prototype medications and any new material that hasn't been presented yet, or that hasn't been tested on yet, rather. And when you're looking at those prototype charts in your textbook, sometimes they can be really overwhelming. They're just packed full of information. And I encourage you when you're studying that you definitely focus on the things I say in the recorded lectures, right? I try to pull out and sift out some of the important information for you so you don't have to do that yourself. Also, sometimes students ask, do I need to memorize the dosage? And the answer to that is no. Right? If there's a number or dosage that I want you to know, I will specifically say that. For instance, when I talk about potassium, I'm sure to mention that the rate of infusion for potassium shouldn't be more than 10 milliequivalents per hour. So that's an infusion rate that I expect you to know. I say it in lecture. But just in general, all the prototype drugs and all the different dosage and rates and things that you may see for those, you do not have to memorize. Do you have to memorize the peak, onset, and duration of every drug? No, it's impossible, right? When we talk about insulin, there will be some that I want you to know. And again, I will specifically tell you that I need you to know this. For our purposes right now, you just need to know what those terms mean. So peak, onset, duration, right? So that when you look in a drug book and look up information of a drug, you know how to interpret those values. So now we're going to take a quick peek at our homework assignment for week 2. So our assigned readings are fluid and electrolytes, chapters 15 and 16, and then on your own, ATI chapter 30, iron is what you need to be reviewing. So in terms of fluids and electrolytes, we're going to be focusing on the different types of fluid, blood products and blood transfusion, and fluid balance and imbalance. And of the electrolytes, potassium is the only one we're covering at this time. So the chapter has calcium and sodium and different electrolytes, but potassium is all we're worried about. Next, I give you a brief A&P refresher of sympathetic and parasympathetic nervous system, because you have to understand this in order to talk about adrenergic drugs and cholinergic drugs. So you get a brief little refresher there, and then it moves into the recorded lectures for chapters 15 and 16. In terms of homework, you have 2 Kahoots. You have an SNS versus PNS activity. Again, this is an A&P review. That you need to have those down prior to going on and learning about chapters 15 and 16. Chapter 15 and 16 actually have some homework assigned with it that need to be submitted in the Dropbox. And then we're going to utilize the Swift River V-Clinical that you used once the pandemic started and you went online and couldn't go to your clinicals anymore. So we're going to do 3 activities in Swift River this week, 2 med passes, math refresher, and then some dosage calculation practice questions. while we're talking about homework, I just want to remind you that all homework is required to be submitted, whether it's a complete and incomplete, or whether it actually has a point value assigned to it. If you miss the deadline, again, you don't get any points, but it's required to be turned in before you're able to take the exam. So I encourage everyone to stay on top of it. Part of it is this course is about to take off, right? So you had your intro to farm, but now this chapter 15, 16, it's really going to get into, where you're going to need flashcards and really start to study and trying to commit all this information to memory. And these chapters are very important because this information comes up again and again and again in different lectures. And you need to get it down now, or else you're just going to keep having problems as the course progresses. I want to say one quick thing about points for homework. Not all homework has points, just like if we did Kahoots in the classroom, I wouldn't give you points for participating with that, but I would expect you to participate. I do assign points for some of the homework, right, to give you a little incentive to actually get that done. Here's the thing with the points. I know students have said before, it's not worth enough points. Why isn't it worth more points? And so these homework assignments are non-exam points that are part of that 4% category. And for me, it doesn't matter. If you want to pretend, you go ahead and add a 0 on the back of this in your mind so that it's worth more points, you can do that. You can add zeros on the back of these so they're worth 200 points, or whatever you want to do. What it is if I want you to think of it this way. So if I did half of my homework here, and we're just going to use this one for simplicity, I did half of my work, I would get 3 out of 6 points. That's 50% on that assignment. Whether this is out of 6 points, or 60 points, or 600 points, or 6,000 points, it would still equate to a 50%. So the total points of the assignment isn't what matters. It's that percentage that you end up with at the end of the semester that affects that 4% grade. So I hope that makes sense to you guys. I just want you to know that there is a value to this, and it's just, I work in smaller numbers. It doesn't, regardless if you get 100%, it's 100%, whether it's out of 6 points or 60 points. All my points are gauged sort of at a lower level. So let's go over our week 1 homework. I enjoyed reading your entries, your discussion board entries about Nurse Vaught and your opinions. Seems like the majority of you didn't think she should be criminally charged with the negligent homicide. I did look into it, and it looks like she has her disciplinary hearing with the nursing board this month, and her criminal trial begins in July. So more to come on her, and we can see how that goes for her. The NCLEX blueprint, hopefully you were all able to take a peek at that. And why I encourage students to look at that, and I required it as part of that discussion board, is because you can see that it's pretty vague about what's important with pharmacology. So when students ask, there's so much information, why don't I get a study guide? It's because what you're given for the NCLEX to prepare isn't very specific either. So with my lectures, I try to highlight important information for you, but in general, there's no set study guide that you're going to get for the NCLEX, and that's why we don't hand them out in the nursing courses. Let's see here. Let's look at your midterm and lab value homework. So the midterm part is pulled up now. Go ahead and pause the video and review it with your own to make sure that you have all your answers correct. Okay, and then let's look at the lab values. And this one, I definitely want everyone to take a close look at, because I know a lot of you do not have the MedSurg book. So I asked if you had it to use it. You didn't have it, that's fine. But I want you to study the numbers that are listed here, the values that are listed here, because these are the values that you're going to need to know for the rest of the program. These are the values that coincide with the MedSurg textbook that you're going to use for MedSurg 1, 2, and 3. So albumin normal range here is 3.5 to 5. Why is it important? It's because albumin is one of the major protein player in the body, right? So we talked about drugs that are highly protein bound. So if we have low albumin, we have lower sites for those drugs to bind to. And remember, protein bound drugs cannot exert their effect on the body. So if I have less protein, that means I have more free drug, and I'm going to see more effect of that drug in the body. ALT and AST, when I see these, I should be thinking liver. You have to have these numbers memorized, these lab values. I'm asking you for these values on this homework. These are values that you have to know, and you have to understand what they mean. Not just for exam 1 or exam 2 or 3. Throughout all of pharmacology and throughout your career as a nurse, you need to know these values and what they mean. So ALT and AST represent liver function. Normal ALT is 4 to 36. Normal AST is 0 to 35. If you get lab values that are high, higher than 36, higher than 35, that would indicate that there's some sort of problem or dysfunction with the liver. So with serum creatinine, the normal levels for a male are 0.6 to 1.2, for a female 0.5 to 1.1. BUN normal levels are 10 to 20. Serum creatinine and BUN reflect kidney function. If these values are elevated, that would reflect a problem with the kidneys, some sort of kidney dysfunction. Glomerular filtration rate, even in the med-surg textbooks, they can give you an average in one spot that says it's 125 mLs per minute. But what you need to know is that glomerular filtration rate needs to be greater than 90 mLs per minute. If the glomerular filtration rate, or GFR, is less than 90, that would be an indication that something is wrong with the kidneys. When I looked at participation in the Kahoot quizzes, it looked like the most challenging question was the question about normal urine output, milliliters per hour. So you need to memorize now for exams, but more importantly, for when you're in the clinical setting, that the urine output that you're watching for is 30 mLs per hour or greater. So if your patient's urine output drops below 30 mLs per hour, again, you're worried about kidney function, the kidney not functioning correctly. So I just want to end by congratulating you for making it through the first week of summer pharmacology. Only 11 more weeks to go. We can do this, right? You got this. And I wanted to again remind you that it's about to really take off, especially with chapters 15 and 16. This is what pharmacology is all about. So if you're not dedicating time every day to study pharmacology, you're going to need to start doing that, or else when it comes time to test and you try to cram last minute, it's just not going to be enough time for you to commit to memory what you need to, and to feel confident and comfortable with the information enough to be able to apply your knowledge when you're taking those NCLEX style questions. So you can do this definitely, but you need to stay up to date and on top of your work. And again, if you ever have any problems or questions, please reach out to me.